I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. Well, welcome to Hopeful Hands. I'm your host, Dr. Tara, and we are continuing our conversation on hormones this month. Let's move into another big name that you know, estrogen, and how important estrogen is. So we talked about progesterone last week. Make sure you check that out. We're going to talk about estrogen this week, and next week we're going to talk about testosterone and DHEA. So we're going to hit them all here and just give you a high-level overview of these very important hormones that are not being taken serious, especially in perimenopause and menopause. So let's begin and just address that estrogen is a key hormone and plays an extremely vital role in maintaining balances during these transitions of perimenopause and menopause. And we have to shine a light on this one because there's a lot of fear around hormone replacement. And actually, these topics, I should say, came to be in my conversations with other healthcare providers in all areas, as well as a lot of research that is coming out there on the need of hormone replacement therapy and dispelling these myths that all hormone replacement therapy is going to automatically give you cancer. We have to just stop that nonsense talk and talk about the importance of replacing hormones because of cardiovascular risk, bone fracture, and many other things, mood, day-to-day life. Like, why should you not feel good on a day-to-day basis? Why should you have to struggle and suffer? That is nonsense. So off my high horse, on to educating you on estrogen today. Estrogen is a hormone produced primarily, again, by the ovaries and has numerous functions that it impacts. And again, we're going to talk today about perimenopause and menopause specifically, but understand it does play a very important role in regulating menstrual health cycles. And its partnership with progesterone is really crucial to regulate our menstrual cycles. So it stimulates the growth of the endometrium, or AKA your uterus's lining, to prepare it for the possibility of pregnancy after ovulation. When pregnancy does not occur, those levels drop. And then in turn, you have your menstrual cycle starting. So again, this is where I say, I know you're probably not trying to conceive in perimenopause and menopause, but your body is still moving through that notion every month. Those hormones are on I want a baby this month type of roll, even if that's not what you want externally. So when pregnancy does not occur, again, those levels drop. But when there's a consistent fluctuation in those estrogen levels, this results in irregular menstrual cycles. And so it really is a key sign, having irregular or these really big jumps in dates of your cycles, that there's underlying hormone imbalance going on. And just understanding how vital it is to take that serious. Let's not go and jump to a hysterectomy, please. Let's work on your hormones, okay? That is an option. You don't need to have a hysterectomy. You need to have your hormones balanced. I have an episode that was put out about a month ago that I really want you to listen to called Stop. Don't get a hysterectomy until you listen to this, because I think so many of you are just put in this position of being told over and over, this is the only way to take care of this. Even if you're having fibroids, things like that. Fibroids are estrogen excess. There's things you can do to help mitigate jumping right to a hysterectomy if that's not what you want or doesn't feel right for you in this moment. So let's move on to bone health. Estrogen plays a very vital role in maintaining your bone density and balancing it with those ongoing cycles of bone reabsorption and formation. It helps slow the rate of bone weight down in the body. And this becomes so important, especially before and after menopause, when estrogen levels decline. And they decline sharply when menopause hits. So we've got to be proactive on the perimenopause side of this and really watch that and do things to help with your estrogen levels, because this drop in estrogen can and does accelerate bone loss. And that leads to osteopenia, osteoporosis, AKA at risk of fractures. So hormone replacement therapy and other treatments actually can help stabilize these levels and mitigate these risks to really help maintain bone strength. And again, should be part of your overall year-to-year conversation with your healthcare provider.
Let's move into cardiovascular health. And you've seen a pattern from last week's conversation. These hormones are very vital to these conditions, and they are significant in aiding with our flexibility of arteries, promoting healthy blood flow, preventing the buildup or hardening of our arteries. Yes, hormones, yes, estrogen are super important to this. It's not just this willy-nilly hormone. So let's say you even had a hysterectomy. We still have to address your estrogen and your hormones, because when we have estrogen in play, another big thing it does is help regulate our cholesterol levels. So estrogen actually helps regulate HDL, which is a good cholesterol that we want high. And then it helps decrease our LDL, which is our bad cholesterol and triglycerides. So when I see women who have had heart attacks or have these ongoing levels of cholesterol issues and no one's addressing their hormones, shame on you healthcare providers, for real. Because if you don't understand the correlation of hormones to cholesterol, grow that patient's team and bring in some providers who understand the importance of hormone replacement and regulation and some things that we can do to help balance our hormones, because that plays a huge role in our cholesterol and our cardiovascular health. So the lipid regulating effect helps reduce the risk of heart disease, period. Plain and simple. And I'm sorry, but I want all the women to not be at risk of having a heart attack. And if you want to know why women are having higher heart attack rates, let's go back to hormone conversations. Let's move into mood stability. Estrogen's influence on the brain is so important to those neurotransmitters, just like progesterone is. It affects serotonin and dopamine, which are vital to regulating our mood. And when we can work with these neurotransmitters, estrogen can actually enhance mood stability, provide a sense of well-being, and reduce the risk of mood disorders such as anxiety and depression. So again, this is super important during perimenopause with those fluctuations happening, menopause. It's never too late and never too early. Let's just put it that way, to start taking your hormones serious to help alleviate these symptoms, especially mental health. So let's look at some symptoms, because estrogen, of course, naturally declines during perimenopause and menopause. And let's look at some symptoms again. You're going to notice that they are very similar to the same. Very similar. There's some difference we're going to look at as progesterone. So again, irregular menstrual cycles. The fluctuation in estrogen does lead to irregular periods, heavy bleeding, skipping cycles, large clots. Again, to fibroids as well, hot flashes and night sweats. Low estrogen levels lead to the disruption of the body's temperature regulation system. And so that's where these hot flashes are coming from. Mood swings, they contribute to anxiety, irritability, depression, vaginal dryness. So the low estrogen leads to atrophy, dryness, and that causes pain and issues with intercourse. Bone loss. Estrogen deficiency, as we talked about earlier, accelerates bone reabsorption, leading to osteoporosis or fractures. So we have to take hormones seriously for bone health. Urinary incontinence. So estrogen deficiency actually weakens the pelvic floor muscles, and it contributes to urinary incontinence. Memory issues, brain fog, forgetfulness. Estrogen, it needs to be front of the mind. It impacts with cognitive function and to concentration issues. Hair loss and hair thinning. So hormonal fluctuations do in fact impact our hair loss and hair thinning. Let's look at how hormone replacement therapy can alleviate some of this. So symptom relief. Straight up, hormone replacement addresses symptoms such as hot flashes, mood swings, irregular menstrual cycles by replenishing and giving your body those bioidentical hormones back. It promotes physical and emotional well-being as well. Bone health, again, we can prevent bone loss and osteoporosis by balancing our estrogen levels, reducing our risk of fractures, and maintaining bone density as well. And this is really important, again, in those that are especially postmenopausal already, because it's just going to keep declining and accelerating that bone density issue. And so you have to, no matter what age and stage we're in, take this seriously. Cardiovascular health, it's so important, again, to reduce our risk of heart disease and then overall quality of life. Like, why, should we go on feeling crappy day to day when you can have some hormone replacement to improve your overall quality of life? And we can navigate these perimenopause and menopause times so much better with fewer challenges than those that have gone before us by debunking these myths that exist around hormone replacement therapy. And again, there's some studies that have linked it to an increased risk of certain cancers. And we have recent research that says truly risk varies depending on you as an individual and other types of duration and type of therapy. So it's essential to consult with a healthcare provider who's open to so many different options and super educated on hormone replacement and ongoing training and research that's out there, and really find this personalized treatment for you that can be tailored to your needs. Understand dosings and types of therapies out there, not just being given one format, one type, and knowing that your uniqueness, it should be taken into consideration, and knowing your options, working again with someone who can give you options. So again, to summarize, estrogen has a very crucial role in women's health during perimenopause and menopause, from our menstrual cycles, bone health, cardiovascular, mental health, and you having an awareness on this puts you just at such a greater position than, I would say, than those that have gone before us. And knowing that there is options out there for you, grow your healthcare team. Thank you so much for listening to this week's